Boom! And we are live with another episode of the Brownwater Banter Podcast. My name is Jared Seymour.
My name is Joey Cates.
Oh, that is right. And we got a great show for you guys. Mixing it up a little bit here. We're going to be talking with Kendrick. He's in the studio with us this evening. We're going to be talking about men's health. He's the Forever Young Clinic. Keeping yourself, weight loss, age, defying, staying healthy,
Anti-aging.
Keeping your hormone replacement correct,
mentally correct,
everything. We're going to jump into the stigmata behind everything. It's going to be a great episode, man. So stay tuned. But before we jump into everything, we're going to thank the sponsors like we always do straight out of the gate. Dr. Robbie Williams over at Southern Magnolia Smiles, man. They're on the socials at Southern Magnolia Smiles on Facebook and Instagram. If you're looking for a great local dentist, check them out. Make that appointment. 2023, the year to keep your mouth clean. Give them a call at 228-215-1202, man. Tell him that you heard about him on Brownwater. I'm over here trying to brand his business for him.
I don't know why Bob doesn't use that.
Dog, man, it should be on the front door.
Here to keep your mouth clean.
That's right. Our good buddy Jesse Hill, man, over at Hill Tree Marketing. Thoughts and prayers are out with him and his family right now.
Absolutely.
His daughter had to go through an emergency surgery. From what I understand on Facebook, she's doing well, doing better. But a scare that no parent wants to have to go through. But we still want to thank him for being a part of our team. Jump over to hilltreemarketing.com. Check him out. If you need a website built for any reason, IT work, photography, videography, aerial drone cinematography, Jesse's a one-stop shop. And again, he's local, man. hilltreemarketing.com. Check it out. And you won't be disappointed. So We're going to keep rolling here. Taylor and Cox Law Firm, our good buddy Tyler, they've been practicing law over there in Pascagoula for over 30 years. If you find yourself in need for some representation legally, reach out to Taylor and Cox Law Firm, 228-696-0111. They specialize in criminal law, family law, and civil litigation defense. They come highly recommended from people that we know in the industry, man. The 5th annual Downtown Ocean Springs Crawfish Cook-Off. It's going to be May the 27th. So what is that? Not this weekend, but next as we record this. Man, great time. You buy
Don't
a wristband.
Don't worry about showing up because we're going to dominate.
That's right. We're competing this year too. So you buy a wristband when you get there, or you can buy in advance at Downtown Ocean Springs. Just go to Downtown Ocean Springs Facebook page. There's links there to buy the ticket ahead of time. But you pay one price. You go through all the teams that are competing. You get to vote for a Viewer's Choice Award, People's Choice Award, whatever crawfish team you think cooked the best crawfish. There's going to be beer for sale, live music. It's a really good party. Downtown Ocean Springs, Government Street, right next to Pleasant's Barbecue.
That's
so
it.
Go check that out. No, it's a damn good time.
We're either going to win big or lose big.
That's right. There's no in between, baby. Cedar Swamp. Our buddy Rocky Brooks over there doing big things, man. Look him up on Facebook. See the number 2 in Swamp. If you are looking for a great local place to get all your outdoor apparel, he's got rods, reels, tackle, gear, brownwater hats, everything you need. Located Gaucher Van Cleve Road. Leave the interstate, head south. It's on the left. And then he's got a new store on Pass Road in Gulfport. So Rocky's expanding too, man.
Yep.
We're happy to have him on board.
You know what they say? Hang around. If you're not rich, hang around people who are rich.
There you go.
So that's what we're trying to do.
And then the last but definitely not least, that's Mr. Kenny over at Ocean Springs Marine Mart. He's got his fishing tournament June 3rd and 4th, man, up to $12,000 in cash and prizes. I got it on the screen. Joey's got it in the for real. And he's got an inshore and offshore division, man, from cobia and snapper to redfish, speckled trout, flounder, and blackfish. $50 entry on the inshore, $100 entry on the offshore. The weigh-in's going to be right down there at his at Ocean Springs Marine Mart, down there, Ocean Springs Marina. Sunday at 7 p.m. So it's June 3rd and 4th. Okay, so it's 2 days. But it's a damn good time. We're going to be down there hanging out. So if you want to get the kids, the family involved, family fun.
Yeah, that's good stuff.
Family-friendly fun. It's going to be a damn good time.
Yep.
Though. So, all right. So let's jump into it. So Kendrick, man, thank you for stopping by, dude.
Thank you. For
this has been about a year in the making, I think.
Yeah. Hey, man, you guys are cranking. So
we're trying.
Man,
that's a good
we
thing.
Apologize.
Yeah,
we apologize to everybody.
Yeah.
It took so long.
It's awesome. Awesome.
But so let's talk about your background before we get into what you do specifically for men and now women's health, and we'll get into that. Yeah. But you're a nurse practitioner,
yes,
right? And so tell me from start in the medical field.
Yeah,
how'd you get in?
Start in the medical field. Graduated, I don't know, it was 21, 22, long time ago, about 15 years. Started in critical care. Knew I just wanted to kind of get as deep as I could, learn as much as possible, because I had goals to continue to pursue higher education and of course open a clinic one day. So did that for a couple years. Moved over into pulmonology, which is specializing in lung disease. Did that for 6-7 years with the local pulmonologist. Learned a ton. Great group of guys. And about 5 years ago, decided I was looking for something different, jumped into orthopedics, something that kind of correlates in the same sense, bones and muscles, and, it has a lot to do with, breakdown of the body. And did that for 5 years, again, with Memorial, and I've been there for about 15 years. Finally had an opportunity to get into my passion, which was transition into men's health. And, about 2 years ago, found an opportunity in the schedule to make that happen. Started part-time, and man, it blew up from there.
Yeah.
So, I mean, now I'm here full-time, left Memorial. And I got my own clinic and been cranking for about the last year and a half, and just expanding like crazy. And I've been real blessed.
Yeah. So I think you filled obviously a niche in the market that needed to be addressed. I think in the past, at least 2 years, I think the attitudes, minds, opinions of people when it comes to specifically talking about hormone replacement or testosterone replacement for men, there's the discussion is there now. It's not quite as like taboo, hush hush.
Yep.
And guys we're looking for that, right?
For sure. I mean, it's not in the back of the gym.
Right,
I mean,
exactly.
that was the kind of the stigma is, hey man, you're on testosterone, you got to talk to someone in the back of the gym. Well, the bad thing is when you correlate testosterone with the gym, you take out 80% of the people that really need it. I mean, it has nothing to do with the gym. It has really nothing to do with the gym. It's a bioidentical hormone. You're born with it. I'm not doing anything special. Only thing I'm doing is taking your level where it is now and putting it where it should be. It's nothing foreign to your body. So people have this stigmatic steroids.
Right.
Steroid is just a chemical compound. It's not even specific to testosterone. I mean, there's when you say steroid,
corticosteroids.
Corticosteroids. You go to you go to your doctor and you go get a steroid injection. They're not hitting you with tren or testosterone. I mean,
some people ask that too. They're like, "Am I going to get jacked?
Dude, am I going to get jacked?
Yeah.
No,
Do I need to go to the gym after all this?"
No, bro, it's an anti-inflammatory. So, there's just the term steroid has just had a bad stereotype. And, like you mentioned, I think over the past couple of years, it's becoming more mainstream. Talked about.
Well, I think the whole thing is coming back to the mental health and how you feel and, stuff like that. And testosterone makes you feel like you want to get up and go.
It's a game changer.
That's where it is. I mean, think about when you woke up when you were 18 years old and
you were ready to go.
Yeah,
you were ready to rock and roll
every
all
way.
day.
Every way.
You were ready to rock and roll.
Like you go to work, you hang out, you do all
you party all night,
all
turn
night
around.
Long. Yeah.
It's crazy how many people, when I see a couple months after I initiate therapy and they tell me, dude, it's like a light switch. It's like I literally I'm back to life.
Right.
And that's what keeps me. I enjoy work, man. I go to work and it's just talking to people and hey, how you feeling? Like, they're like, dude, 100,000 times better, and that's the feedback that keeps me grinding.
Yeah. Well, explain the testosterone. Let's start with the guys first. So, it has to do with losing. I mean, what time does the testosterone drop? About what? It's different in all people, right?
It's different in all people, but even studies, man, it's crazy. I saw a Yale study recently that compared men nowadays and the average total testosterone level to 20 years ago, 25% decrease. No different in age, 25% decrease in average testosterone levels compared to 2 decades ago. Nothing other difference. So to know that we are already seeing a decline in the average male, and at one point in time it was thought to be around 25. You start losing 1 to 2% of testosterone.
Right.
I'm seeing guys 25 that are just depleted. I mean, it's crazy.
Is that because we're becoming a softer generation per se?
Yes. But
right.
It is. I mean, literally, I tell guys, man, I was like, dude, you're not a stud, man. You look 30 years ago, these guys were studs. They got up and they grind and they were men. I got guys, unfortunately, I'm not saying anything wrong with them, 25-year-old guys that are coming in with having legit low testosterone, not anabolically induced, not abusive.
Right.
But we're seeing a continued decline in total testosterone at a much younger age. So at one point in time, when you think at the 40, the 50-year-old guy that finally hits his, whatever you want to call it, midlife crisis, and he's like, oh yeah, I'm getting old, and you're starting to get withered away and you're losing your strength and you have no energy. I'm seeing it 15, 20 years earlier.
Wow.
So it's crazy. It's the recognition to know that it's not just an old guy thing.
Yeah.
You know, I mean, it's
the
early.
comments are coming through already, so
It's crazy.
you're not going to see them till. But
Yeah.
like
Oh,
this,
gotcha.
it says this generation is some bitches.
Exactly.
And the study
I'm
and by the
telling
way,
you.
guys, this may not be safe for work. I'm sure there'd be a couple
Yeah.
customers
But I
that
mean,
fly
you
out
look
through
at it.
here.
I mean, those guys. I guess you're talking about 20 years ago. So you're talking about my grandfather's age. I mean, we're
Correct.
talking about-
Correct.
Those were the Korean War guys.
Yeah.
Those were the tough cook. I mean,
Dude,
but what's the science?
think
out-
that changed. That's what they're trying to figure out is what changed. So what has changed?
Activity level, right?
Activity level.
We sit
Yeah.
behind desk all day,
Oh,
and they were outside grinding.
Right.
Poor the lack of activity, obesity is
Yeah.
completely way spiked, and then you got to start thinking a little bit. I don't want to call it like conspiracy theory,
Right.
but hormones in foods,
Right.
processed
I don't
foods.
think that's a
Chicken
super-
breast.
But if you dig into it, there's some sketchy stuff behind the scenes, man, with all these big marketing
Well, I don't even necessarily think it's like because I guess maybe the tin full hat guys would be like they're injected
they're
in to control the
injecting- no,
population.
I
It's
don't mean
I
like
think
that.
it's
No,
like
I
they
think we
give
need
hormones to animals to make them
Chickens,
grow
yeah.
faster,
Correct.
and then that has
Correct.
repercussions. To
Yeah,
what you
and
eat,
we
you
eat
know?
a lot of processed.
We eat a lot of
foods now.
processed
It's
food is
bad.
huge,
Yes.
man. Well, and that's bad because a lot of people look at the groceries right now.
Right.
It's so expensive.
Right.
Right.
Who can go and buy, grass-fed
Right.
hen
Well,
eggs? They're $38.
Well,
Eating healthy is the most
Eating
expensive
healthy
thing
is
there
so
is.
expensive, man. It's
It
really
is.
expensive. So it's kind of a catch-22. People are eating any faster foods and they're processed. And I mean, you look at the kids nowadays; they're monsters. They're peaking so much earlier.
Mhm.
Young girls are
Coming into
developing a lot
womanhood,
earlier.
yeah.
Womanhood, man, is crazy. I went to my boy. I got a fourth grader, and I'm looking at some of these other fourth graders. I'm like, the guys are bigger than me,
Right.
the fourth graders, and then the girls are developing, and I'm
Yes.
like, wow, this is insane. You know,
Right.
so it's scary, but it's happening across the board. Hormone deficiency, women, men, much younger, and it's happening. There's no way around it.
Yeah. So what's your background in? Obviously you work out. Like, at what point did you say men's health and is something I want to be a part of
Because
on the medicine side of it?
Yeah. Well, I always had the medicine background. So unfortunately, I had the bodybuilding with the medicine. I was
So
the go-to
bodybuilding.
guy.
You're a bodybuilder.
Yeah.
But yeah, I started
Okay.
in lifting and weight resistance. So I was the guy that everyone come up and said, "Hey man, I'm doing this. What do I need to do?"
Right.
I was the resource, inadvertently. I mean, I just knew both sides of it. So I saw how bad it was where people had accessibility to all these anabolics very easily,
Right.
very
Yeah.
easily to get these underground products, but they're abusing them. They don't know how to run them. They're taking these anabolics. They're abusing them. They're taking them wrong. They're doing these big cycles, and these are gym guys. So I started there. So
Right.
I recognized that it was a problem in the gym setting, and I wanted to try to help people get better, optimize their health without the risk factors.
Do it safely.
Do it
Yeah.
safely and
Yeah.
manage it correctly so you get the benefit out of it because it's a great medicine.
Yeah.
And it's a medicine. It's a
Yeah.
hormone. It's something that we already have. We're born with it. I
Yeah.
mean, it's not a foreign substance. It's not
Right.
it's not weird. It's not
No,
something
no.
I'm introducing that's not normal. So that's where I think people get this misconstrued idea about steroids.
Yeah.
It's
You're not
testosterone.
talking about. Yeah, you're talking about natural born testosterone.
Natural bioidentical hormones that are just being repleted, taking you from here and putting you back here where you should be.
So it's not anything new. This has been
Mhm.
around since, hell, they was in the Olympics. They had the big scandal in the 60s with the
Oh, for sure.
Russians using them and all
Yeah.
that.
Huge.
So it's not, so I guess what I'm asking is then seeing it in the gym side of things, it's never been that it was illegal if you had a prescription, right?
Correct.
But I just don't think were doctors writing it
No,
at any point?
no,
Any providers? at
It
any
wasn't
point?
because it hadn't reached that level yet. Now we're in this anti-aging generation. I
Right.
mean, just look. I mean, you got Nugenics all over.
Right.
You got HIMS and erectile dysfunction
Yeah,
stuff,
yeah,
and,
right.
and women's products everywhere. All these anti-aging products. So I think it's a big push in just learning how to reverse or slow down the aging process. And they've realized how detrimental hormone sufficiency or a lack thereof plays a role in that.
Okay.
Yeah, I don't think we have it as bad as women, and you've recently added women.
Yeah.
Women are a ball of hormones. You know
Yeah.
what I'm saying? Especially when they have kids and
Yeah.
stuff like that. I might have to sleep on the couch.
Yeah,
tonight,
treading, man. You're treading thin water right now.
We're gonna get on that too in a little bit.
Yeah.
Explain the levels to me, because everybody's born with a level, right?
Yes.
And from what I've gathered off of it, nobody really knows
It's a
your
range,
level.
just
Yeah,
like anything else.
it's where
problem.
you feel
Right.
good.
Yeah.
So how do you go in and say, here you go, this is what you get. Now tell me how you feel. Explain that process.
It's custom. You already nailed it. You cannot group everybody. You can't throw everybody in a range.
Yeah.
You know, you have to find out where you do well at.
Right.
You know,
Your wife's already in the comments.
Oh,
Just
Christ.
FYI.
you're
FYI.
crashing here,
Yeah,
brother.
she's already in the
Oh,
comments. Easy, big boy. There you go.
But no, that's what it is. It's just recognizing that. Do I know what your testosterone level was when you were 20? No, that's
Right.
when you were at your peak in life. Who checked their testosterone level when they were 20?
Zero.
Nobody.
Yeah.
So that's a variable you will never know. So whenever you come in and you see me and you hit every check mark on the list and your test level is 450, I don't look at you and say, bro, you're normal. You're not a candidate for anything.
Right.
Because your body is insufficient. It's telling you, it's symptomatic. It's telling you that you need more.
Right.
Whether or not I knew what it was 10 years prior to that, whether I knew that you were at one point in time 1200 and that
Right.
was your peak, and now you're 60% lower. I don't know that, but I treat my patient. And that's what we're supposed to do as medical professionals. You treat your patient, you listen to them, subjective information, you compare it with your objective, and through medical practice, you do what's best for them.
Yeah. And is there a lot more science out there now? Not that there wasn't in the past, but are there new studies that are being done? I'm
Yes.
sure you're up to date on
Oh,
all
for
that
sure.
type of stuff and reading that constantly.
And I'm glad. I'm glad there's a lot more studies to show the benefits of
Right.
testosterone replacement therapy, not only in men but women, and also I don't know what you want to call it. What do you call it when you like overload? Like when you cancel something, or you
Abruptly stop?
Mythbusters. When you like Mythbusters,
okay.
when you bust it,
Yeah.
I don't know what you call it.
Uh,
Mythbuster, whatever.
Close
it is.
enough.
It's
close enough.
Whenever
Yeah.
you I don't know. Whenever you cancel the idea that was right. I
Okay.
can't think of the word, but
Okay.
anyway.
Yeah.
So it's basically showing that all along they were wrong.
Oh, I got
They
you.
were wrong that now studies are debunked.
Yeah.
That's what I
There
was
we
looking for.
go.
Mythbusters,
Joey
they
got it.
debunked. Came in from the
Hey,
clutch
that guy.
three beers later.
3 beers later,
Yeah.
That's
baby.
what it took, man.
Yeah.
So no, it's debunking where at one point in time testosterone had all these negatives and risk factors, and you're going to get prostate cancer, and that's since been debunked. That's not true.
Okay.
And I think the more literature and studies are coming out, I think more people are realizing how critical it is to live a better life, quality of life, longevity, and actually increases lifespan.
Okay.
And decreases mortality. So, I mean, again, these things are getting bigger in the cardiovascular world.
Mhm.
At one point in time where it was believed that it had higher cardiovascular risk factors, but it's actually decreasing cardiovascular risk factors now, is directly related to low testosterone levels, has a direct link to mortality caused by cardiovascular disease.
Okay.
And that decreases as you increase your testosterone levels.
Yeah. And I'm sure there's a lot of things associated with that.
Yeah.
As you increase those
Yes.
levels, you work out more, hopefully, right?
You're-
Or you're more active
Yes,
or whatever.
That's the whole point.
Metabolism
If I don't
goes
wanna,
up. Yeah.
if I'm energy depleted and I
Right.
want to sit my ass on the couch, I'm not going to go work out. You have to replete that person's energy, that core edge. I call it mojo,
Yeah,
and you
yeah,
have your
yeah, yeah.
mojo to get out there and grind and get back to doing what you want to do. You're going to be more active. You're going to eat healthier. You're going to go to the gym. You're going to exercise. Your metabolism speeds up. You sleep better. Your recovery is better. Your sex drive is better. Your mentality is better. All these things just kind of fall into place, and it's a package.
Okay, so we got another question in here. Ronald wants to know what is the what is normal for a male age around 49? I'm assuming normal test level, but I think we kind of covered that. It's really
Yeah.
There
there's
is no.
there's no-
I have so many people that come in and say, "What's normal for a 50-year-old?"
Right.
It's like, what does it matter if you're 50? I don't care if you're 50. I want to put you where you're supposed to be at 20.
okay.
That's my thinking.
Okay.
I don't normalize, and I don't know if I coined it. Maybe I did. It's kind of cool.
Yeah.
I said I don't normalize. I optimize. I'm not trying to take you from 250 and put you at 600 in the middle of the
You
road.
should make shirts that say that.
Yeah, really, yeah.
Because really, you know the range 300 to 1,000.
Yeah.
What kind of range is that? You
Right.
know, I mean, where are you going to be? I want to be at the top end of any range. I don't ever want to be at the bottom of any range. So to answer, I don't know, Mr. Ronald's question,
Mr. Ronald Williams.
Yeah,
Mr. Ronald Williams.
Yeah.
There is no, there's not a range. I tell everyone I like to put men between 800 and 1,200, and I have my own range because I need to see how you respond.
Yeah.
I treat the patient. I don't treat the numbers.
Yeah.
So
if
I don't know how to answer it.
If you're in the comments right now and maybe you're thinking about this, what are some of the symptoms that I'm feeling right now that makes me want to come to you?
Fatigue. That's the number one. Number one that people come out and say, man, I'm just tired. I get home off of work. I don't want to get off the couch. I don't want to play with my kids. I don't want to go outside. I don't want to go to my shop. I don't want to go fishing. I don't want to do my hobbies anymore. Weight gain, decreased sex drive, erectile dysfunction, just that lack of just brain fog, that lack of cognitive clarity, poor sleep, joint pains, all these things come around to it. And it's funny, but you see these hymns and all this stuff. And people say, yeah, man, I'm getting treated for erectile dysfunction. It's like erectile dysfunction is a side effect.
Right.
You're getting treated for something that you're not even fixing the problem to. That's the problem.
Mhm.
Is I tell people it's like handing you a pail in a boat that's got a hole in it.
Yeah.
All they're doing is just pailing you out. You're not fixing the hole.
Yeah.
I do both.
So the first step in this is, because I know this from experience, you're going to come in and see you and you're going to tell you, hey, man, I'm exhausted all the time, blah, blah, blah. And you're going to send them to go get labs, correct? Is that the process?
I do labs in the house.
Okay.
Now, I in my facility, in my clinic, if you're local, I have a phlebotomist in the office, so it make it convenient as possible. I don't want people to have to say, now I got to go somewhere else to go get labs. If you make it inconvenient, you're just adding another hurdle. You're adding another obstacle. I try to make it a seamless consultation to blood work to I call you later in the week and we establish a treatment plan.
Okay. What are you checking in those labs?
Oh, I check. So the trick is to not only recognize the fact that these symptoms are pretty vague. They're kind of vague. So my job, my experience, my knowledge of knowing what to look for and what not to look for, you have to rule out other biological problems. You got to say, man, are you tired and because you're obese and you have sleep apnea?
Right.
Are you hypothyroid? Do you have cortisol problems? Are your stimulating hormones wrong? So my job, and I'll tell you, just like I tell everyone, my job is to find out why you feel that way. It may not be testosterone. Now, if it is low testosterone, now I got to find out if there's a reason other than just a biological breakdown that you have low testosterone. Sleep apnea is huge.
Right.
Yes.
Most people don't know that. Sleep apnea will drive your testosterone down. Stress levels increase cortisol, which drive your testosterone down. Obesity drives your testosterone down, increases insulin resistance. So all these things kind of trail into the same fact of once I rule out that there's no other pathophysiologic reason why you have low testosterone, you got low testosterone. I'm treating you.
Yeah.
Or I'm doing both. Or if you got sleep apnea, I'm going to treat you for testosterone and get you feeling better. And I'm still going to send you for a sleep study.
Yeah. And what was weird to me is that you test guys for estrogen. You check the estrogen level. You check the X and the Y's and all kinds of other crazy stuff, like the labs.
My panel's
like
crazy.
This. It
looks like this billboard, man. My labs are crazy, So again, I'm very thorough. I'm telling you, I'm aggressive, but I'm thorough.
Yeah.
I'm not gonna put you on a product that I'm gonna slip up and have the risk factors creep up and tag us in the back.
So the comments are blowing up. This is cool. So let me try to go back through them. So Margaret said she has fatigue.
Okay.
So I don't know if you want to treat her or not.
I think I know who we're talking about.
Yeah, exactly. So a lot of people are into this. Where's your office located? So before you answer that, though, somebody tagged. It looks like forever. Hold on. I don't know if it's the same one. Anyway, click on the Brownwater. I put a link to your Facebook page.
Oh, perfect.
We don't have all in, but it's the new Facebook page. So
perfect.
You changed Facebook pages a little bit back.
I did, and I was just not social media savvy, so I had to actually outsource that. So that was part of it. Making a new page, trying to generate people to come to it because I ran into some hurdles, with. I don't even know how to run the thing, but I messed it up somewhere along the line. I screwed it up somewhere along the line. Bottom line is, but so I hired someone. So we do have a new page, and we were trying to put a link to generate traffic back over there. So I know it failed somewhere along the lines because you were still following the old link.
Yes,
so
and I got it shared on the screen,
that.
guys. So y'all are looking at it right now. This is the one, Forever Young Men's and Women's Health Clinic, and we're going to dive more into that.
Yeah, I guess the women's the same way, right? It starts the same way. You come in, and then you get the blood thing, and then I guess you read it backwards. Instead of testosterone, you read estrogen, right?
I also check testosterone for women.
Yeah.
They're detrimental, and I don't know if we're going to get into that we're getting in now.
Go ahead.
Whatever, let's rock and roll.
The same things that men complain about, the same things that women complain about. And that's why I treat with testosterone. Same thing. Energy poor, sex drives down, and weight gain. Those are the 3 components that women really get a huge response from testosterone replacement therapy.
I was way too far into my medical career before I realized women needed testosterone. I didn't know that.
Yeah.
I got women to come in and say, I didn't even know I had testosterone.
Yes.
Yeah.
A girl that I worked with came in and she was like, I've been having these problems, fatigue, like all the stuff you're naming.
Yeah.
She goes, and I got on testosterone. I laughed. I was like, yeah, right. She's like, no, I'm serious. I'm like, bullshit. You did.
Now I'm
you
bitching
didn't.
400
You know,
pounds.
and that didn't happen. You know,
She has a beard.
Yeah,
she's
right,
like jacked.
no, it was
it's
not that.
like that.
It was not like that at all. And she was like, I feel so much better. And I had to look it up. I'm like,
It's real,
wow,
man.
why
It's real.
I missed
Yeah.
that somewhere in the textbook. I didn't really realize. I mean, I knew that
They
they
don't-
might have, but I didn't know it was like it played a factor as an afterthought.
Barely
or,
touch on it.
Right.
Barely touch on it. Even and that's what the problem is you expect women, they have a gynecologist. They go and see
Right.
them yearly. You expect them to have all the checks and balances. And unfortunately, I have a ton of women that come in and say, they don't even check my hormones.
What,
It's like it's almost kind of like cattle herding through
And,
there.
I mean, they have hormones that they check, and of course it changes. But when they have babies, everything's out of whack.
Everything gets out of whack,
Right.
but women know they're going to go through menopause.
Right.
They know this
Right.
is going to happen. But I tell everyone, you don't go from 25 to menopause
right.
overnight. This is a transition, so things get screwed up between then.
What's the range for a woman? You said
In
guys
testosterone?
Yeah.
Yeah.
The normal range for a woman is 10 to 60. Again, very huge, 10
Right.
to 60.
Okay.
Yeah.
So and that's a 6 times. Just
Right,
take your
right, right,
man's
right,
from
right.
300 to 1,000.
Right.
That's only 3 times. A woman's 10 to 60.
What's the dose for a
Wow.
woman look like?
That's
when you prescribe. How
That
the hell
is
you
the
do that?
crazy thing is I'll touch on how some of these women are mistreated, because if you are unfamiliar with how to compound testosterone,
Okay.
they're being prescribed man concentrations of testosterone
Right.
being injected and trying to get this kind of loop pattern
Correct.
because of the half-lives. And you know that
Yes,
about
yeah,
medications
yes,
and how
yes.
you prescribe things.
I've always heard it's like a little.
It's
pellets?
a little
It's a little pill. That's
a little
injected-
pellet.
Yeah,
There is
pellet.
pellet
That's,
therapy.
that's just
So-
a different.
So it's just a different
way of
modality,
administration.
Okay,
a different
okay.
way for them to get it. But that I have so many women come on and say, yeah, my primary or my OBGYN, I express this to them.
Mhm.
They said my testosterone is low. They're giving me this injection once a month. And I'm looking at it. I'm like, if it says 200 milligrams per milliliter, that's a man's dose.
Right,
And what they're
right.
trying to do is surge
My
you up.
bitch is going up.
And I got women that come in with voice changing. They're growing
Wow.
hair. And I'm telling them, I said, I'm sorry. I feel like they tried,
Right.
but they didn't do it appropriately. You know
Right.
what I mean? So, so the normal dosage for a woman is 10 milligrams a week,
Right.
whereas I would typically give a man, if I averaged it, I got everyone on different doses. The majority is probably about 200 milligrams.
Right.
Substantially
Right.
different. I mean, that's 20 times.
Now you say
Yeah.
compounding. Do the women have to compound their own dose, or can
No.
you order it at 10?
I order it
Okay.
at 10 milligrams per milliliter or 20 milligrams per milliliter, so I can formulate it to make it suitable for that woman.
Okay.
So
okay.
I don't have to take 200 milligrams and microdose it and try to tell
Right.
them you got to do
That would
this,
be
and that's
terrible.
oh, it's
Yeah.
terrible.
Yeah.
Or you got the women that are literally getting sent with a 200 milligram per milliliter, which is your standard out of prescription,
Vial,
out
yeah,
of a standard
yeah.
vial that is prescribed to men, and they're giving this dose that's supposed to, kind of loop up and squirrel over for the month, and they're
Right.
having substantial problems
Yeah.
because they're having the masculinity problems because it's not appropriately dosed.
And so that would be one of the stigmatas I think that you'd probably have to address with women
Mhm.
is, well, I don't want to get on this
Mhm.
testosterone
Because I'm gonna start growing hair.
I don't want to
It's
grow
big and
hair.
yeah, exactly. And it's like,
That's huge.
when dosed appropriately, specifically for a woman, these issues don't occur.
Exactly. I tell them the same thing. You have it already. You have
Right,
testosterone. I
right.
tell them as like, you've been walking around for the last 30, 40, 50 years with testosterone. It's just
This ain't nothing
insufficient
new.
now.
Yeah.
It ain't, you hadn't been growing a beard before then. All
Right.
I'm doing is just taking it and bioidentically repleting what you're missing.
Yeah.
And you want to stay away from the
The
roller
peaks and
coaster.
troughs.
You want to be consistent.
That's why I do once a week injections, even for the women. Now, typically I would do twice a week for men because I like not peaks and troughs.
Mhm.
Remember, men are getting a substantially higher dose.
Let's break that down for people who
Mhm.
aren't in the medical
Medical
field.
savvy.
So when you inject a medication,
Mhm.
subcutaneous or intramuscular is
Okay.
where we're going to be going.
Okay.
Explain that for them. So it's
So
going to
there's-
peak your level, right?
Correct. You got a peak level, and then it will
Within
taper
24.
24 hours usually. What it
within
takes to absorb
24
it, yeah.
hours, and that even changes whether it's subcutaneous or intramuscular.
Correct.
So for women, I typically prescribe subcutaneous. because it's a little more dainty. You know, it's like they get a smaller needle. They're women. They don't want to inject. They don't want to be put under the intramuscular. I'm injecting testosterone.
Not as deep in the layer.
Not
of the skin.
as deep as a layer in the skin. It's not as vascular, so it actually absorbs slower.
Mm-hmm.
So that's why we get away with once a week for the women. The men,
where do they usually
either kind of belly fat,
okay.
you know, kind of a pinch, a little almost insulin needle, a little pinch belly fat, or in the hip butt area.
Okay.
And the leaner women, because they don't have a lot of subcutaneous fat, they'll get a little knot there in the belly, so they don't like that.
Yeah.
And I'll say, okay, we'll just move it back here.
Right.
You know, a little bit more tissue is there, and it absorbs just like any other thing. You know, it's like if you hit and it swells, it's going to reabsorb. You know, your body's going to absorb that in over a duration of time. For women, usually about 7 days, and once a week.
The goal there is to keep that level to its elevated spot that you want it as direct line as you can. You don't want a big, huge spike and a big,
you don't want the roller coaster ride.
Exactly.
And that's the problem with pellets. And you talked about pellets and pellet therapy. Some people do great with it. Some people don't.
See, I thought the pellet was more streamlined. No, it's more of the roller coaster.
The problem is it ramps up, and then once you get to the top, what do you got to look forward to?
The drop.
A long drop. Okay. So now you may feel great 6 weeks into it, but now when it starts coming down, they're not going to replete them until another 2 or 3 months. So the problem is you get this long, dragged out, just kind of crash.
And that's when you start getting grouchy.
You get grouchy
angry,
and
tired.
Now there's a convenience factor to that.
Right.
You pop it in there and you don't have to do anything. But think about all the things you can't do. You can't take it out.
Right.
You can't take it out. I tell women, it's like, once it's in there, you got to ride it out. If it's a roller coaster, if you go like trash, I mean, you got to ride it out. It's a surgical procedure. You know, it's very sore from what I hear. I've never had them, but I just get a lot of feedback on it. Very sore. They can reject. I've had plenty of people say they were in the shower and they got pellets on the floor. You know, it pushes itself out. The body rejects it.
It's a foreign body.
It's a foreign body. Body pulls it out. It can get infected, and it's expensive. And you got to kind of you can't manipulate it. I like to manipulate, and I say that because I think people need that level hormone level. Level hormone level. Level levels.
Yeah, there you go.
Level.
Double level, baby.
You don't want these peaks and troughs, man, because then I mean you don't want to be crazy. You don't want to be riding the crazy train.
Right. No more than that. Never mind. I ain't
no
gonna say
more.
That. I didn't say that.
Or you gotta sleep on the couch tonight.
You want to be shacked up together.
You mentioned, and my wife's in the comments. She wants to know if you need an MP in December. She's finished it up in November. So you mentioned the guys in the back of the gym doing it inappropriately. I would assume dose would have been one thing they would have been doing wrong too, right? But the more important thing in the part where you come in as equal to that is, what are we monitoring? What do we need to watch out for? Because it isn't a magic fairy drug, right? It's not. It does have risks.
It
just
does
like
have
anything
risks.
else.
And just like anything, I mean, you can buy Tylenol over the counter. You take 30 of them, you're dead.
Done.
You know, you get liver failure. So you know, it's something that if you do correctly, it's perfectly normal. If you put your doses super therapeutic and you're running all this stuff and you're this big goofball in the gym that's not doing it appropriately, you're going to have trouble. So what I look for, a couple risk factors are, with testosterone replacement, you create more red blood cells.
Right.
Okay. Erythrocytosis, you know, is something that your body just naturally does. A lot of times your body is on this hemostasis. You build so many, you break down so many. So it'll balance itself out. Some people just cannot accommodate that. So either you need to donate regularly.
Right.
So what I tell people is, man, it's a give back to the community. Go and donate every 3 to 6 months. It keeps your levels where I need them. You're giving back to the community, and I don't have to worry about risk factors for your blood pressure going up, blood clots, that sort of thing.
Right.
So that's the major risk factor.
It works because it's like your blood gets thick.
Yeah, it's thick.
It won't pass through.
It's
so
viscous,
as soon as you pull that, you would sit in a chair, and when you give blood, you can feel the pressure in
it's
your
an oil
head.
change. That's
It's
how
like,
it's an oil change.
Yeah,
but you mentioned
awesome.
two big things. High blood pressure is a risk, right?
It is,
especially if you're running high levels.
Correct.
Right. You could be walking around and have a potential stroke from that, or
Absolutely.
from the fact that you throw a clot, right?
Blood clot. So those are two things you really got to make sure that you're keeping an eye on. The other potential thing is people think about prostate. You know, the one thing is prostate. At one point in time, said, "Man, I'm not taking testosterone. It's going to give me prostate cancer."
Correct.
It does not cause prostate cancer. 100% proven. It's been debunked.
There you go.
There it is.
Been debunked long time ago.
Word of the day.
Word of the day. So
word of the day.
the problem is it's if you don't appropriately check a foundation number. You know, you have a PSA, which is your antigen that shows inflammation of the prostate. As long as you keep an eye on it and you know it's not elevated, you likely do not have prostate cancer. If you do have predisposed, undiagnosed, you have it cooking in there, and you start testosterone without knowing it, it's like throwing fuel on the fire.
Okay.
You know, it will completely ramp up the duplication of those cells. DHT attaches to the prostate, DHT being the active form of that metabolic form of testosterone, getting a little too in depth there. But what it does is it creates prostate enlargement, and if it's cancerous, it's going to duplicate those cells. So as long as you keep an eye on it, though, it's just like anything else.
If
you don't miss it.
If you're monitoring that through labs, you're going to see
you don't miss it. And I tell everyone, the one thing I always ask, hey man, how you feeling? Everything going good? How you peeing?
Right.
That's one of my first questions, because the prostate wraps around that urinary tubule. First symptoms you're going to experience, problems peeing. You know, so as long as you ask the appropriate things, you're watching the labs, it's normal, just like any other medicine.
All right, we got some more questions coming in. Let's see. Do you take Blue Cross insurance? That's one there. You do?
So I will say this, and my program, it's kind of a hybrid. Consultations and medications are cash pay. The reason why is insurance are still not savvy on this yet.
Yeah.
Okay. So a lot of them do not cover these plans, but insurance will cover the big portion, which are your labs. So I'm credentialed with Blue Cross. I file labs. Now, if you got a shitty plan, they're not going to pay for it. I mean, that's just because you go anywhere, you got trash plans. Just because you have Blue Cross will make it good.
Right.
You know, so I tell everyone, I don't know what they're going to pay, but I'm credentialed in network. I will file your labs, which takes the huge component of that financial cost, and then the consultations relatively low, $150. Come and see me.
So
don't let people ask. A lot of people, $150 to come in. That gets you established. That gets your chart rolling. That gets our one-on-one. That gets us into the next stage, which is where I have to determine what labs I need to order, which one specifically. We get the lab work that can be filed to insurance, and then based upon our treatment plan, I have kind of packages that I put together. So I'm sure someone's going to say, what am I thinking at? What typical costs? The average package for testosterone replacement therapy, $150 a month.
Okay.
And that covers the medicine, all the management, all the supplies, estrogen blocker, which we didn't really talk about.
Well, I was going to keep going into that, but go ahead.
And so again, it's kind of like a membership, man. I take care of you. You pay. You can come and see me every week. We talked about earlier. I don't care. I will see you every week if you're having problems, and that's where I fine tune stuff. I'm just very, very hands-on. I want to manipulate. I'm going to be like, dude, I'm going to start it. I don't know. I'm going to pick a dose because, again, it's an educated dose. I don't know. know. Like you said, everyone's different. I'm going to pick a dose. I'm going to see you back in 6 weeks. You're going to tell me, hey, man, I'm feeling great, or I feel okay. I'm going to draw blood, and I'm just going to fine-tune it.
Yeah. You mentioned it though. So we talked about high blood pressure. We talked about blood clots. What's another thing that you got to worry about?
We mentioned estrogen.
Yeah.
And because estrogen, men have estrogen. We do want some estrogen. We don't want too much. We don't want too little. Just like any other hormone, you got to balance it appropriately without getting too much in depth. Testosterone breaks down into DHT, what I mentioned earlier. It's like the active form of testosterone, and estrogen. So as you replete testosterone, you inadvertently increase estrogen. So you just got to keep an eye on it.
Yeah.
Now, most people don't. They don't know how to prescribe the medications to keep that number down. I do. I keep the estrogen in check. You balance it.
Yeah.
Happy-go-lucky.
I think a lot of people think that once you get on testosterone that you're going to start like throwing tables and ripping your shirt off.
Yeah, they're like, dude, I'm jacked.
I'm jacked up.
It's not, man. I have probably 9 times out of 10 people come back and say, I feel so much more mellow. Because if you're irritable, if you're tired, you're grumpy. It's not that you're pissed off. You're not an angry dude.
Yeah.
You're just agitated. You're irritable.
I think probably a lot of those rumors though came from all the old school wrestlers that were shooting juice,
and a lot of them died.
They were snorting.
A lot of them died.
They were snorting coke.
They're all up in the background, man.
Yeah, I mean, you don't think Ric Flair would tell you it wasn't just
roid rage.
Roids.
They came up with that for a reason, and that was because of the guys in the gym.
These guys are
just
jamming up. They're super juicing. They're banging 3 cc's of anabolics. They don't even know where it came from.
So you're on edge all the time.
Some bathtub in Taiwan,
stuff.
And that's the other thing is I got these guys that come in and they're like, I'm running this, and this. And I'm like, dude, you have no idea what you're putting in your system.
Right.
Yeah.
You know, you really don't. You may think you have a trusted source, but you don't know that person. You don't know where it's coming from.
Right.
So that's just the other thing. I mean, how much do you want to play Russian roulette with some injectable that you have no idea what's the impurities in it? Is it concentrated? Is it even what it's supposed to be? And it's just, man, just trying to transition people away from it, because really, for $150 a month, I'm going to manage you, and I'm going to give you I'm going to put you on the medication that's appropriate for you. You don't have to order it from Mexico or, you know, wherever you're getting it from. And it's going to keep you safe.
Yeah.
You know, so I really try to promote just people getting away from those underground anabolics, and it's going to always happen. I mean, that's just part of life.
Right.
But, you know, I try to make sure people are as safe as possible.
Did we talk about the male dose? I know you mentioned the female dose, but a typical, and how often do you take it? Did we go into that?
So the concentration that you would typically get would be and I mentioned earlier, for women, I usually do 20 milligrams per milliliter.
Right.
A man's concentration is 200 milligrams per milliliter. So 10 times stronger. Men usually get twice a week injections. That's because, again, I'm not looking for these big peaks and troughs. I'm looking for real consistency. I'm looking to level the levels.
Mm-hmm.
So twice a week for men, usually once a week for women.
So you say twice a week, 400 milligrams a week?
Oh, no, I'm sorry. Half a C. You know,
Yeah.
if I had to guess that 80% of my guys really are around 1 milliliter a week, half a cc twice a week.
Gotcha.
Yes.
So
Okay.
I have a very rare amount of people higher than 300 milligrams milliliter. But to say that, I probably have the most not guy that you would think is even on anything. He's like a 58-year-old bartender,
Mhm.
you know, kind of a squirrely fella, doesn't work out, doesn't go to the gym. He's got my highest dose. His body needs 400 milligrams a milliliter.
Wow.
The old guy that doesn't go to the gym. It's just every person is different. There's so many variables that play a role in how your body metabolizes this. Your protein, like your nutritional status, sex hormone binding globulin, that gets a little bit more in depth between what your body can actually utilize versus how much you have in the tank. You know, so all these things have to be considered whenever I'm picking out a dose. Yeah. So it's not stereotypical like, oh man, how much you on? Oh, you're on 300 milligrams, and my guys only got me on half a milligram. You know, they compare it because you think it's relative to the number, but it doesn't.
Right.
I got guys on 50 milligrams a milliliter, which is some low that their testosterone just shoots sky high. They're just super sensitive to it.
Right. And that goes back to you ordering the dose, waiting a amount of time, then checking their levels again and saying, here's where you were, here's where you are. How do you feel?
Exactly. Yeah. So it's all fine tuning.
Do we know the long-term effects of staying on TRT?
Dependent.
Dependent.
You know,
for a while. Do we know that?
Your testicles are going to stop making themselves.
Yes. So the long-term effects is just remember, this is not a foreign substance. So it's just, if you had high risk factors when you were 20 because you had high testosterone, your risk factor is not going to be any greater because you're 50 and have the same levels that you had when you were 20.
Right.
So because it's a bioidentical hormone, as long as you keep it in check and not super therapeutic where you have those potential risk factors, there are no long-term risk factors. Now, what it does do, it will cause testicular atrophy.
Right.
You know, and some guys are like, dude, what is that? I'm like, bro, your balls are going to shrink, man.
Yeah, that's fine. I don't need them anyway.
That's my thing. I tell them, look, and that's one of my main things. That's one of my main things. You come into me, and that's the problem that I run into is the young guys that come in that really have low testosterone that are still family planning.
Right.
I'm like, look, man, testosterone's not on. You're not a candidate. You know, I'm not going to jeopardize anybody's fertility. And I tell them, look, there are some other things, you know, peptides are huge right now. I don't know if you guys know about the peptide world, but very huge. What it does is they stimulate your body to produce naturally versus being a synthetic additive. So there are options for them, but because of the compromise of the fertility, my younger people, 25, I have to balance that. I mean, you know, I have to say, look, man, I that's not my first go-to. If we fail other you know, conservative treatments and you're like, look, man, I'm just tired of feeling tired or feeling like trash. Then we'll go to that route. But I'm not one to jump in there and say, hey, bro, you're on testosterone. Let's do it.
Right.
You know,
you want everybody to have a chance to have a family.
Oh, for sure. I never want to compromise it. That's one of my demographics. It says future family planning. Like, I want to know that ahead of time. I am not putting anybody on testosterone to compromise their fertility, because what it does, it doesn't make it impossible, testosterone suppresses the hormones that stimulate the testicles to produce sperm.
Right.
And
it lowers your
testosterone.
sperm count.
It lowers your sperm count.
Yeah.
So, but it's like fish in a barrel. You
So-
got 10,000 of them in there, you got a good chance. You got
When-
4,
yeah,
you got less of a
yeah.
chance.
when,
Yeah.
you, when you're at our age and you are so over having kids
Yeah.
Yeah.
that you don't give a damn.
That's what I
You
like.
move
Yeah.
that part over
They
into
go-
the benefit.
they go
That's
straight-
the benefit. It's in a benefit.
Do you do
category now.
castration? Do you do castration?
I swear to God, I had a guy this week. What is today? Wednesday? Maybe later last week. First time I've ever had it. He said, "Man, is it true?" Which is common. I get that. That your balls shrink. I'm like, yeah, man. It's like, once you get to a point, you've had your kids. What does it matter? So
Right.
what?
Yeah,
They've
who
done
cares?
their job.
Right.
He said, I got big balls. And he said, and I want to get rid of them. I'm like, cool, man.
Yeah, let's do it.
You're in
Right.
it. You're
Yeah,
going to
yeah,
get the
yeah,
advantage.
yeah,
I thought
yeah.
he was going to go off on another track. He said, I got big balls and they cause a problem. I'm
Yeah.
like, cool, man.
ACDC, baby.
Yeah.
Let's shrink those balls for you,
So
sir.
we've hammered on the testosterone specific part, but you kind of brought up the peptides, and that's a good. It ain't just testosterone that you're.
Oh,
working
not
with
at
there.
all.
What are some of the other stuff people may not even be aware of?
Yeah. So when I have people call my office, I've instructed my front staff to say, hey, what are you interested in?
Mhm.
What are you looking for? I offer anti-aging,
Okay.
weight loss, and hormone replacement. So within that anti-aging also include peptides, and hormone replacement doesn't necessarily mean it's going to be a synthetic.
Okay.
I have other options, peptides. So peptides are huge right now. You get on the internet, you put in peptide therapy, they're coming off left and right. They got all these weird numbers, MK677, CJC 1995, whatever. So the bottom line is you got all these different compounds that are being used to all do one job. They are all injected to go upstairs, tell the pituitary gland to produce more growth hormone, which is great for cellular recovery and sleep. That is huge. That is huge for people that say, I've dealt with chronic sleep disturbance. I can't sleep. I toss and turn. I do this, or I wake up and I'm sore. My joints are painful. The peptides have a huge opening in modern medicine now if they clear FDA, because you're not shutting any other systems down. Only thing you're doing is basically antagonizing
Fuel
your
the
body.
fire.
Yeah.
Yeah, man, you're like, hey, man, let's pump it up, so you're not shutting down anything, and only thing you're doing is just ratcheting up, man. So I'm huge on peptides because, again, there are no negatives. People say, what happens if I stop them? Nothing.
Yeah.
You didn't do anything. Only thing we're doing is you just stop taking them.
Yeah.
So great. Peptides are there. They're going to continue to cascade forward.
That's HCG, right? Aaron mentioned in the comments. Blame it on the FDA. Let them compound HCG.
HCG is very touchy, man. Unfortunately, I think it was a great product. HCG is not the peptide that I was referring to. HCG was that's a natural hormone that's produced. Women, it spikes whenever they're pregnant. Whenever they take a pregnancy test, that's what is tested, is HCG. Human chorionic gonadotropin. Weird word. The last word is what's important. Gonadotropin, gonad.
Yeah.
It's a stimulant to the gonad. So peptides are also doing the same thing that's not synthetic like HCG. So there's something called gonadorelin. Baseline, gonadorelin. It's stimulating to produce those hormones that tell your balls, lack thereof, testicles, to produce more testosterone or sperm. So there are options for the young guys that come in and say, I feel like trash. I want kids. And I'm like, cool, man, look at this. Look at these peptides.
Yeah.
Look at these peptides,
Yeah.
because there's no downfall. What's the only thing that's going to happen? You don't get better.
Right.
And then now you just got to say, hey, man, what's more important? Do we compromise, or I use them together? I'll use them in adjunct therapy. I'll use a peptide to continue that low dose stimulation, and I'll bring in a little testosterone, ramp it up, and I say, look, you got to understand that there is going to be some level of compromise.
Right.
But if you're willing to take that, where I'm going to do my best to keep those stimulating factors going, I've had plenty of people still have successful conception.
Sweet.
There you go.
That's awesome.
Your wife's back in the comments. She said, all right, women's turn now. So what about anti-aging for them? Is it?
It's anti-aging is huge for women. Not only the fact that hormone replacement is one of the major ones.
Right.
I mean, we all know that women's ovaries are going to fail. That's
Right.
what menopause is. So
Mhm.
when you replete that, that's the number one. You got to return the estrogen where it should be. They have 3 sex hormones. It's a little tricky. They have progesterone, testosterone, and estrogen. So you got to balance all three of those. They have a little bit harder time to manipulate because as a woman is going through menstruation all month, their hormones are constantly changing.
Roller coaster, yeah.
They're roller coaster ride, so whenever they get to a point of menopause or they're perimenopausal, you have to determine, again, the same type of modalities, what works for that woman. I'm going to start you on estrogen. I'm going to put you on progesterone. I'm going to start you on testosterone. And you got to manipulate all those all together. Now, the one thing that I have to worry about with women, we all know that women, breast cancer, ovarian cancer, cervical cancer, uterine cancer. Those are the big four. They are estrogen driven. So if there's a strong family history or a previous history of estrogen driven cancers, I will not replete estrogen. So you just got to do your due diligence in making sure that there's not a huge family, history, and you're not gonna throw fuel on the fire.
Right.
So that's what comes into the consultation. That's why I'm very in depth. I'm aggressive, but I'm very in depth. So once I get to that point, I'm cranking. It's like once I say, hey, you're not a candidate, I'm not giving you estrogen, but that's the least of your concerns. I'm going to give you progesterone. It's going to help you sleep better. It's going to knock those night sweats out. Women, night sweats are huge. Hot flashes, night sweats, and insomnia.
Little balls of fire.
They're crazy. Yeah. so
gracious.
the progesterone is great for that. And then, of course, testosterone. And they don't even realize that. Most women say, I didn't even know I had that. But I'm tired. What do I do? I'm going to say, I do the same thing for you that I do to all the men. I'm going to ramp your energy up. I'm going to get your sex drive cranking, and that's another problem. Women have changes downstairs. It just happens as their hormones are changing. Yeah. They're drying up. They're having issues downstairs, and they may not be very fond of talking about it. But whenever they're prompted, they're like, "Look." I say, look, you having trouble, what's going on downstairs, your intimacy level. And if there's problems, then you just got to restore that because, again, it goes back home. If the man's feeling great, woman's not, there's a lot of friction.
Button heads, yeah.
They're button heads.
Yeah.
So I have a lot of couples. That was a big thing I did recently was a couples consultation.
That's what I was about to say. You should do it.
I did couples consultation. I did. I gave a discount. I gave a discount for couples consultation with a steak dinner.
He partnered up with Half Shell.
I love Half Shell. I love Half Shell.
Yeah. That's marketing.
Yeah.
Cut this.
I don't know if we're supposed to mention any names, but no.
Not until they pay you.
No, it is. It's crazy because I started seeing that if one is almost, I don't want to say pushed into it.
Correct.
It's kind of like, hey, we're not on the same page, or we both recognize that we're having issues. Let's go see them together.
Right. Yeah,
I'll do the consultation together. It's good to bounce them off of them. If I'm talking to you, I'm like, hey, how's the sex drive doing? What's happening in the bed? And the other guy's like, it's down. So they kind of play off each other, and it makes it a little less, I think, tense.
Yeah. The question, is there anything treatment to help that monthly roller coaster? But I think that goes back to what you were saying, the replacement.
The replacement. So again, those three things are constantly moving with women. They're a little more tricky between those.
But you got three options.
You got three.
Yeah, you got three options.
You got three
options.
Yeah. So it is. It's just trying to dial those in. They're just tricky, man.
Yeah.
They're hard.
Hey, big surprise.
Yeah, I know, right? I didn't think that I needed to say that.
Right.
They're just tough, man. They're tough to balance. But I think that's where I think that's where it goes back to. And I'm not shunning any of the gynecology. They don't have the time, I think, to really sit down and to find out that subjective feedback, like what's happening. We're going to try this. I'm going to have you come back. And it takes a lot of fine tuning that I don't think they have enough time for.
Are they pulling labs?
I think they do. I think they're pretty like generic though. They're pretty generic. I mean, if you're 35, gynecologist is gonna say, "I'm not checking your hormones. You're 35."
Right.
And that's what happens. I get those 30-year-olds coming in and say something's not right, and my gynecologist won't order my labs.
Well, they don't want to check. A lot of gynecologists are getting old, like old school.
I think they're kind of old school.
New ones.
I think it's almost like not like a mill, but I mean, you go in there, you get your exam, and get out of here. It's like I don't want to have the problem.
We're gonna get like slammed with gynecologists. Like you don't know. They do a great job.
I love gynecology. I love it, and I even have gynecologists come and see me. Right. I treat gynecologists. I mean, they are not dialed in, and people think that because you've gone through medical school, because you have a specialty, that doesn't make you a specialty in everything.
Right.
I have tons of physicians that come and see me. They're not prideful.
Right.
I address them all appropriately, and they
Right.
come to see me because they're not feeling good.
Right.
And I get them feeling better, whether they're gynecology, whether you're a urologist,
Right.
whether they're surgeon or whatever.
Right.
So it's not a prideful thing. They just know this is not in my wheelhouse. I need help.
Yeah.
Yeah.
Does do you do any type of like, because I see the women are lighting us up down here in the comments now, like do you do like the Botox stuff, like skin stuff, or is that's
So yeah, so I when I initially opened, I had I got certified and thinking that I was going to be able to accommodate aesthetics. I can't. I don't have enough time.
Right?
So
Yeah.
it's funny that you say that. I actually have an interview this week with another gal, physician's assistant coming out of Florida, and that's what she wants to do. And I said, hey, I'd love to, because I have space. I have a ton of women and men. Even men are saying, hey, man, why can't I get Botox? You know,
Yeah,
so
I've heard of guys getting that.
guys
yeah.
get it. So I got a ton of them. And I'm like, look, I would love to bring you on board just to do aesthetics. So it's happening. It's just I haven't up to this point.
Right.
I was credentialed to do it. I'm certified to do it. I just didn't have the time or the opportunity.
Gotcha. We kind of skated over though the fact of like the business angle of this for you, and I wanted to touch on that before we wrap things up. Is like you started out, like you said, you left Memorial, you was doing the orthopedics as you left, but like how did the business side of that start? So explain that to us. We touched on it a little bit before before we went
the
live.
Business, the business was, man, I just jumped. I guess I'm a little I don't want to say spontaneous, impulsive to say I know what I want to do. I don't know quite how I'm going to do it, but I'm just going to do it. I'm going to figure it out. You know, it's kind of like how I screwed up on remodeling my house sometimes. You know, it's kind of like, I could do those floors. That dude does floors.
I've learned that the hard way. Yeah,
floors are a pain in the ass. So I give all the respect to all those guys. I mean, that's what they make things look easy. You know, you watch
that's
YouTube,
their job, right?
That's
their
what
job.
they specialize in.
Yeah.
You watch YouTube, everyone does things in 5 minutes. It looks great. When I did backsplash, it looked like shit. You know, but no, not to get off, man. It comes down to, I said that I was going to do it. I wanted to do it. I had an opportunity, a little bit of time in our schedule with orthopedic surgery. You're not always in surgery, or you don't have clinics. So I had some down days, and I said, if I'm going to do it, this is the opportunity that I'm going to do it. I did it. I started in a rented office space with nobody. You know, I used the person staff to help me just get people, just to help them check in.
Right.
And I sat in an office with my cell phone, my personal cell phone, and I made it happen. And I don't even know how I did it. I would see you. I'd bring you back.
Mm-hmm.
I'd see you. I'd write your note. I'd bring you to my phlebotomy chair. I would personally draw your labs. I would spin the labs.
Damn, I didn't know that was even allowed. Really? You know what I mean? Like
I got a centrifuge from LabCorp.
Yeah.
I spun my own labs. I filled out manually all the labs, and I had
one-man band.
And then I'd go home, and you know my fiance. I would go home, and I'm on the phone at sometimes 7, 8, 9 o'clock, and I'd text you, hey, can I call you for your lab results? Because I was calling people's lab results at night. I had no more of the time.
Damn.
But you know what? I've been.
That's the grind. That's the hustle.
Grind,
part.
man. You can't if you don't put in the work, there's no reward. So now I've been blessed. I got my own office. I got a staff of 5 people. I've been able to delegate that out. I got a great office manager that's keeping efficiency, and it's just doing real good. The problem with this type of business, there's no algorithm. There's no you open a Starbucks. They give you a pamphlet. This is how it goes.
Right.
You don't have that.
Yeah,
I had to figure out softwares that would integrate and
uncharted territory.
Uncharted territory. So there's been a lot of loopholes. There's been a lot of problems that I've just been able to kind of decompress and try to work around. But man, it's been cranking.
Where is your location at? Because
it's on Pass Road.
Okay.
There's a little strip right here on Pass Road, but before Biloxi, coming from Gulfport, there's a new area. It had a coffee house, Layla's Coffee House. There was a I Love Mac and Cheese. There's some attorney's office. There's a Pass the Juice, brand new shopping center right there. Gulf Coast Exotics just built a big spot right there.
Yes.
I'm in that new building right there.
Okay.
So very easy, convenient. Everyone, again, I see a ton of people come through there. I have people just stop just to come by and just say, Hey, I was just in the area.
Right.
Come by. So the good thing is with it being so convenient, because I draw labs in-house, I have a ton of people that if I don't need to draw your labs now, or if I say, hey, I'm going to make adjustment on your labs, come in 6 weeks and just pop in, grab your blood. I'll call you when I get it. So it's so easy that I can just have you pop in, draw your blood, and you can go on about your business, and I'll call you when I get the results.
Yeah. What are your books looking like now? New patients.
Like how many? What do you mean? Like how many am I getting?
No,
like,
like how long? Like if I want to see you tomorrow,
yeah. Wait time.
2 weeks.
2
2
weeks.
weeks?
Yeah.
So not crazy.
No,
not
no,
crazy. But I
it's-
mean, and I've had to even adjust that because I don't want to say you got to strike when the iron's hot, but when you get it in your mind to finally say that was a lot of people say, all right, I'm going to do it.
Mhm.
You know, you probably think about it for a while. I've
Oh,
had
yeah,
guys
yeah,
come in
yeah,
and say,
yeah.
man, I've been wanting to do this for 2 years and I just never got around to it. It's
Right.
like when they want to do it, they want to do it. So I hate when someone calls and says, you know, I'm sorry, I can't, you know, we can't get it you in until 2 weeks. So I hired another nurse practitioner to come in on Fridays to help take in some of those.
Right.
And he's just as savvy, you know, young guy, ER trained. I've known him from Memorial from a long time. He does primary care. So
What's his name?
Jared
I don't know.
Deloach,
No, I don't know.
bald guy, kind of
Jared
bald,
Seymour?
bald goatee and jacked. Yeah.
No,
so-
Jack,
don't have to go to no.
but no, great guy. He does primary care. He did ER for a long time. So he helps me on Fridays because I didn't want people to feel like I got to wait 3 weeks.
Right.
You get discouraged. You don't even want to do it no more. So I got it down to about 2 weeks. I can get new people in.
Yeah.
I love it, dude.
That's
killer.
labs and
That's everything. And I mean,
Yeah.
when you come in, I do it all right then. Now labs take 3 to 5 days to come back, you know,
Right,
but
right,
you don't
right.
come back.
Right.
Once people come in, I see you, I get the blood work, and I say, hey, I'll call you when I get the blood work. And I
Okay.
discuss it over the phone, so it alleviates them having to come back.
That's huge there.
Yeah, that's
I
way
had-
better.
I had to make it to where it was easy to not have so much, I don't want to say crowd, but I'm appointment only, so I couldn't have people just coming back to
Well, you got to
discuss
take
labs.
off work. You
You
got
got-
to. I mean,
Yeah.
it's
It's
not.
not easy for the people to come back an additional day. If they're
Right.
taking off, you know, I'm not going to say, hey, you got to come back and talk to me again on your lunch break
Right.
or, you know, so I call, discuss all the labs, go over it, we come up with a treatment plan, and then things kind of they transpire from there.
What's been the feedback with your clients? You know what I mean? What are they saying?
Great. I mean, like I said, man, it's word of mouth, and,
Yeah.
and literally within a year, I'm over 1,000 patients, and I don't know, I don't even have that to compare to anybody else, but I know that's crazy. You know
Right,
what I mean?
yeah,
To
right.
be able to, you know, to go from being scared to know that what the hell did I do when I left my job
Right.
to I'm rolling, you know,
Right.
like rolling to a point where I can say I made a good decision. I've helped a ton of people, and those people are telling 10 people, and those 10 people are telling 10 people, and that's word of mouth is the best referral you can get. And that's what
Yeah.
I get. People come in and say, dude, you're treating 5 of my buddies. And I'm like,
Right.
great. You know, I
Yeah.
want them because that's the best
Bring
thing.
the
If
rest
they're-
of them.
Yeah, man, if they're doing great. And that was another
Yeah.
thing. That was another promotion that I did recently was, what was it?
Bring a buddy.
Kinda. It was fired first responders.
Yeah.
First responders. So I a huge discount off first responders because they don't get paid for what they really do. So
Right.
I try to do the most that I can for first responders and
Well, and they're a physical.
they're physical.
Yeah.
They're physical. I
Job,
mean, you
you
want
know?
them,
Yeah.
you want them primed up.
Yeah.
They're putting out fires and beating up bad guys.
You
So
don't want to be a little skinny dude.
no, you don't want to
Yeah.
be scrawny or obese.
Yeah.
You know what I
Right.
mean, you got one way or the other. You don't want to be either. So I try to do the best I can for first responders and military.
Okay.
We're huge on military.
Well,
I mean,
you've
we
been
got bases. We
Yeah.
got bases, up and down the coast. So I want that opportunity to be there for the
Yeah.
masses, man. So
You've been slinging out some literature because I even got it in my box at the Iowa High School the other day.
you like that? Yeah,
I sent you a picture of it.
I got stuff going, man. I linked in with a good guy because nowadays social media, how
Yeah.
huge.
Oh,
if
yeah,
you're not
yeah.
if you're not posting, man, if you're not keeping up
You
on
don't
social
exist.
media,
Yep.
you're nobody.
Yeah.
You don't call people, you don't go and hand out cards, business cards. I told I got a badass social media team. We do newsletters,
Mhm.
theory. I'll give them a couple topics. I'll give them some background, some literature on it, and it's just getting people just to see it.
Correct.
Like, oh wow, I didn't know this.
Correct.
Maybe I need to know more. Let me go see
Right.
this guy.
What's the plans moving forward, man? I mean, you sound like you're hyped up. You love what you're doing.
I
It's
do,
going,
man.
It's going well, right? I mean,
I guess I'll let the cat out of that. No, I've been the past couple months. I've been taking what I've been doing and trying to make it duplicatable. And what I want to do is a telehealth doing the same thing, but you got to be credentialed. I've been credentialing in other states. So I want to get credentialed in every state and be able to accommodate telehealth.
So my cousin does that for women's health. She's a nurse practitioner.
Awesome. Yeah.
But I don't want to speak because she's talking about it. Like she goes through the forms, like you fill out all this stuff, and it has a lot to do with contraception, like birth control, like
for sure.
whether you can
women's
get that.
health. Women's health.
Only as
Okay.
far as I understand.
Yeah.
But the company that she works for is credentialed in many states, I believe.
That's the key.
But she works from home and does everything telewise, which is even more convenient for the patient, right?
So you just have a clinic, and the person calls you and says, "Hey, this is what he needs." Blah 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 blah.
Now I still do virtual. I got guys that may be in Hattiesburg or they in Halliburton. So what the good thing was at COVID, I'll go back to that.
Yeah.
COVID really opened up the gates for telehealth.
Right.
Yeah,
It's
I
done
love
great.
it. Yeah.
It's done great. I have a ton of patients that I've accumulated just via telehealth. Now what's going to end up happening is it's already happening. They're starting to kind of close those borders down as far as
Legality.
the legality side
Right.
of it, not being able to practice outside your credentialed state. So I've been working on getting credentialed in every state. It's it's an expensive process. And
Yeah.
it's a very time-consuming process. So what I've done is taken my clinic, Forever Young, and I've figured out all the little problems and the little cracks here and there. And what I want to do is just take it and duplicate it. Have my telehealth business and be able to just have it available for everyone.
Well, without giving away any trade secrets, I'm not asking that, but like, so when as long as you're credentialed in that state, then what is there's no face-to-face requirements.
Nope.
I mean, as long
It's a
as
phone call,
you
right?
can interview them through
It's
you
just
can do it like this.
Yeah, I mean, it's the same as
yeah.
me and you sitting in front of each other. If I got a screen, you got a screen.
Right, right.
We're essentially looking at all these people
And
just sitting in front of them.
100%.
You just get his labs and say, "Hey, how you feeling today, Mister
That's what I'm doing,
Jim?"
It's-
Yeah.
So they just go somewhere and get their lab work done.
Yep.
and
I
then
send an order. You send a lab. There's so many labs. You got LabCorps everywhere. You got
Right.
Quest. I'm not blasting out names. I don't know but you got labs everywhere.
Right.
I already do it. I said, hey man, if you're in, I don't know,
Doesn't matter.
If you're in Alabama, I don't
Right,
care.
right.
I mean, what do you need? I don't need to be in front of you for you to have a conversation with me to get your past medical history and me to fax an order
Right.
somewhere that's close to you. Go get your blood work. When I get it back, I'll call you.
Yeah.
It's easy.
And
It's great.
it frees up your lab.
But it's
It frees
convenient
up-
for
yeah,
both.
it
It's
frees up
convenient for
everybody.
both.
Yeah, I don't like most of them around here. They close at 4:00.
Yeah.
Who
Dude,
gets off at 4:00?
I do so many consults with people sitting in their car.
Yeah.
They're on their lunch break. I
Right.
mean, I takes 15 minutes. I get through, and I'm very in depth. I get through my stuff. 15 minutes, they didn't lose anything. They're on their lunch break. They're on a smoke break. They're on whatever they're doing, and then they can go and get their lab work.
We do that with our Healthy You for our insurance through Singing River. You have to do a yearly. It's
every
blood
year.
work. It's just blood
right,
work,
for sure.
really. And if there's a something's off, then you got to go in and see them.
They kind of like ramp you over.
Cholesterol. So they're like they pinged me on that, and that was before any. It's genetic. It's genetic for me.
That's a
It's
huge
genetic
thing.
for me. And so, but they did the televisit through my cell phone, and they send you a message like, "Hey, your time is just like an appointment. Let's say it's 3:15, right?
Yeah.
Boom. Are you going to be ready to be on thing? Yes.
They
And
hit
it's a
your email
countdown,
link,
and you
yeah.
sit there, and
It's
then we talked
huge.
to the girl, and I was like, I didn't have to go in. That's amazing.
It was crazy.
You know?
Through my electronic medical records, it texts and emails a link for your appointment time.
Yes.
I get on, if you're scheduled for a virtual at this time, I go through my list. I got people in house and I look, boom. Oh, you're virtual. Boom. I send you the link at this point in time.
Right.
Boom. You pop up, I pop up, and we're just talking.
That's
Yeah.
funny.
Yeah.
It's so
I think,
easy.
I mean, of course, emergency rooms, stuff like that. But for stuff like this,
Oh yeah.
To
Yeah,
not
yeah.
have to physically do an exam, I don't need to physically
Yeah.
do an exam on anybody.
Right.
Right.
and I don't have to drive to
You
you.
don't have to
I don't have to
drive
get my
nowhere.
kids somewhere. I don't have to leave work.
For sure. So
Yeah.
I don't know if it's happening. I know there's some new litigation, or I don't know if you call it litigation or laws or regulations coming through or something where they're trying to make a little bit stricter. I don't know what you call them, regulations on telehealth. I hope it doesn't go through. I don't know if you've seen anything about that.
but they've been talking about telehealth that I can remember since 2010, and it was probably way before that.
Right.
But it always comes down to money, right?
Always
like people
money.
don't like it if you can be in Mississippi
For sure.
and affect their markets in Alabama, California.
It comes down
wherever.
to money. It comes down to money, and I hope that doesn't go through because it's not gonna make it. It just makes it more of a pain in the ass, and that's the problem
For the patient.
For the patient, the
Right.
more obstacles you put in front of somebody, the less that they want to try to go outside their way.
Access to healthcare. I mean, that's a big, huge thing, no matter
Yeah.
where you're at, right? It's
Huge.
underserved almost everywhere. It definitely in this state.
Oh man, it's wild here. So
Yeah.
it's gonna be good, man. I hope it's been. I've been working on it for probably the past 3 to 4 months. A lot of paperwork and stuff, and making sure legals are all in check. I mean, when you take something, when you, it's crazy. I was never a business guy, and I don't know nothing about nothing. And I got this whole cool team that's helping me out. And
you learn quick.
Dude, you learn quick about all this. I don't learn so many new words. I know medical words, but cost of acquisition. I'm like, what the hell is that?
What is CAC? Yeah.
LTV.
He's
He's like, dude, how much are you spending to get one patient? I was like, what?
I don't know.
I don't have a clue. That's what I'm going to pay you to do that. You tell me. So, no, I'm learning. I'm trying to get a little more business savvy. I'm trying to make it to where my clinic is rolling pretty good. I got it like a smooth machine. I got the appropriate people in there so I can start, again, making this more available for the masses, because that's my plan. I want this to be available for everybody. This is something that's not leaving. This is not. No. I tell guys, you if you feel bad now, it's not like you wait this out. There's not a light at the end of the tunnel. You're only going to get worse.
Right. Yeah.
I don't have to go nowhere. I say, if you don't want to do it, fine. I'm not going nowhere. You'll be back.
And you're at the kind of
you'll be back.
You're at the forefront of it.
I'm at the forefront. That's what I said. I'm more proactive, and I think a lot of problem with medicine right now is a lot of providers don't want to treat until they have an active diagnosis.
Correct. It's reactive medicine.
Reactive medicine. Yeah. I'm proactive. I'm not going to wait till you're type 2 diabetic. I'm going to check your insulin levels and see if you're insulin resistant. I'm going to treat you before it gets there.
Now, that's a good question. And do you give a little pushback on that? In other words, hey man, you have guys coming into your clinic that are overweight, and then you're like in a professional way, it's like, hey, look, this testosterone ain't gonna be the only thing that's gonna save you. Like, do you implement that? Excuse me, damn, got a little juicy.
I think the
whole way across the table. Do you
his spit on my lip?
Yeah. do you like tell them that and put it as a part of your treatment plan?
I do, because I came from ortho.
Right.
I came from orthopedics,
which is
and they
huge
go hand in hand. It's like, dude, if you're huge and obese and we do a knee replacement on you, that doesn't fix anything. If you're 400 pounds, you need to lose weight, because the only thing you're going to do is wear that knee down again. So I'm not scared. I do it in a positive way. I'm like, look, man, I can only help you so much. We got to implement a new exercise program. You got to clean your diet up, and I do it approprially, and that's what they come to me. I'm as like it's positive feedback. I'm like a coach. It's like a coach. It's like, look, man, I'm gonna tell you the truth. You want to drink? Great. Okay. I'm not going to tell you to stop drinking. Don't go out to eat. Don't do anything. I'm realistic. Look, man, keep it in moderation. Eat clean. Stay away from these foods. Let me get your hormones linked up. You got to pick up your activity. I just treat you. I'm just treat you like a bro.
You're telling the truth, bro. Yeah.
I'm like, I'm very kind of like in this. I'm in scrubs at the office, but I'm like, look, bro, you got to pick it up, man. I can only do so much.
Do you have any of those good? I think I saw a couple like pictures on your Facebook page, like of the before and afters of guys.
I do. I got guys all the time that send them to me, and I'm like, please keep sending them, because I want to keep promoting. I want people to see that, man, this is plausible. Yeah. This is plausible, man. This is like, this is something like, because I don't like it. It's a good and bad. When someone sends me a progress pic, it's usually because they started like this and now they're in the gym and they look great. But I don't want it to necessarily feel like you have to do those. They don't go hand in hand.
Right.
It's the fact of just increasing your activity level, walking around the block, going and throwing the football with your boy, bringing your girl to gymnast, whatever it is. It's like, you got to just step it up. You got to just be more active. And people say the only thing that's stopping me is I have no energy. I got no drive. And once you fix that, now,
then you can roll the world.
Then you're rolling, man. Then it's like you fix the underlying problem.
I got the photo here of one of your befores and after, but that's a good point that you made. It ain't all just about like getting jacked, right?
No, it's not.
It'll show up over there in a second. It's about feeling better. You know what I mean? It's about being able to just have that motivation. There it is, right there.
Oh my guy. I don't know if you can say names. Anyway,
that's a good point.
So I got a couple. I got quite a few of them. He's up there. Of course, he's got that figure. He likes to be jacked. He likes to go to the gym. But again, when you take an element and all you got to do is fix the underlying problem. If you say, I'm tired, I don't want to get off the couch, I'm not going to go to the gym. All you got to do is give me more energy. Right. I'm going to give you energy. I'm going to give you the motivation. And now it's in your hands.
Yeah. So you can take it to whatever level you want.
You can take it to whatever level you want. I'm going to give you the tools. You got to go build it.
Yep.
So
where are you most active at?
What do you mean?
Facebook, social media.
Yeah. Facebook and Instagram. Okay. I think that's kind of the big two go-tos right now. I mean, like I said, I have a social media team. I'm terrible at it. I didn't ever even have what was the first one?
MySpace.
Yeah. I didn't even have a MySpace, man. I'm terrible.
You didn't have Tom?
I didn't have Tom on there, man. He wasn't my first friend.
So,
but
go ahead. Yeah.
I was gonna say, no, I have a team, man, and the good thing is I have so many automations set up that a lot of people can talk to me through the automations. So I'm always constantly checking, even though I may not be able to be in clinic and call them directly. I have so many automation systems that automatically link it to give me accessibility where I can answer questions. I talk to people Instagram me all the time. Hey man, how can I get in? And that's me. Like
Yeah.
I'm talking. I'm like, hey, bro, call my office.
I'm
or
a
give me
real
your-
boy.
I'm
a
real, man.
boy.
I'm a real boy.
Yeah.
I'm real, man. You get me. So I'm still not too big where I'm losing my connection with my patients.
Right,
You know what I
right,
mean?
right.
And that's what I'm trying not to get to, where I still have that personal connection. I keep it's appointment only. You know, I keep only X amount of people, so I don't feel like I'm cattle
Rushed.
herding people.
Yeah.
People get my time, and I'm there at that moment.
Yeah.
We look them up. It's on Facebook. I shared it earlier, but Forever Young
Yeah.
Men's and Women's Health Clinic.
And what's the website? You got a website too, I'm sure.
Yeah,
right?
they're actually trying to blend those together. I had two separate ones, which was getting a little confusing. You know, as I got into the business world, they're like, "Hey, bro, why you got two websites?" Like, I don't know.
Who's better than
I had Forever Young Men's Health Clinic.com,
Yeah.
or
okay.
maybe Forever Young Men's Health.com. And then when I started the women's,
Yeah.
I had a whole separate one, you know,
Right.
dedicated to women. So Forever Young Women's Health.com.
Right.
And then so now they're trying to integrate them. So
Yeah.
it's not two separate spaces. I
Yeah.
can really, you know, ads and all that. I don't have any clue about it. They're like, dude, man,
Yeah.
you got two different routes going on.
Right.
Correct.
We gotta
You're
streamline it.
confusing
Yeah.
people.
Yes.
You got to streamline
Yep.
stuff. So the business side is being taken care of. So I got two different websites. Got a lot of theory on there. Talks a lot about hormones, testimonials, services.
Have they been
things like
combined though? The websites yet?
it's actively happening.
Okay.
So there's two. They're still separate
Okay.
until I think until the end of the month.
Okay.
So next month they will be one.
And what will that be? Do you know? What will that domain name be?
I think it's
probably
I
both,
think
like
it's
your
for,
Facebook
I
page.
think it's
Forever
Forever Young
Young.
Health Clinic.
Yeah.
I think it's going to be foreveryounghealthclinic.com. But I will try to keep that
Send it to us. We'll post
posted
it.
on
up.
there.
Yeah,
Yeah.
Is
The-
current as possible.
The Facebook page is linked in the comments here on the
Sweet.
live,
Yeah.
and then I'll link it in the audio.
Phone number.
Audio.
Is it
people.
on
Yeah,
there?
phone numbers on there. You know, and you know, reach out.
Yeah,
You know,
shoot-
again, what's the worst that you can find out is that you're going to get an in-depth consultation. I'm going to talk to you about it. You're going to get all your labs looked at, and you know, if nothing transpires out of it, so what? You
Well,
got
even,
updated blood
even
work.
if you just get your labs
That's
looked
what I'm
out
saying.
by
Right.
a trained
you got
person,
all those
Yeah.
panels. You can't lose. It's you're gonna.
This is a health screen right there.
health
Yeah.
screening, man. So
228-363-6623.
For sure.
And it's located at 2093 East Pass Road, Gulfport, Mississippi. All it's out there on the socials. You can check it out. But like Joey said, man, even if nothing else, you can go
Yeah.
and get your labs looked at. And if you decide you don't want to do it for whatever reason,
for whatever reason,
you did. It's the 1 month thing. You know, it's not like
it's
you're
not even a month thing.
contractually-
You pay your consultation, you get your blood work, and that's the end of our relationship.
There you go.
But by the time people do that,
Right.
they're
They're
struggling.
in it.
They're
Yeah.
struggling. They're
Right.
looking for help. You know
Right.
what I mean? It's
Right.
not like I'm going to come out because I'm curious. It's like
Right.
Yeah.
my stuff's
Something's
not
got to
working.
change, man.
Yeah, I mean, that's a be, you know, hey man, something I ain't working
Yeah.
downstairs. I'm putting on weight. You know, something usually transpires that reach
Yeah.
out. So by the time they're here, I'm usually like, hey man, I hear you.
Yeah.
You're in the same boat as everybody else.
Right.
This is not. You're not out there on your own.
And what's another thing too? You said like you mentioned like 25 being early, trying to still have kids. You know,
Yeah.
you got to dance. What's the other end age?
Oh, man, I got 80s.
Yeah,
man. I got 80s,
coming
bro.
in. You're like, dude,
Yeah.
we gotta get it back.
Same problems, man.
Gotta get it back.
I mean, same problems, man.
Kickstand ain't kicking no
That
more.
ain't thing ain't working,
Yeah.
bro. I had a guy come in. I don't know, the other day, man. He said this thing just old limp noodle.
Yeah.
He said I ain't seen this thing move in a long time. I said, well, let's see if we
Let's
can't
see
try.
if
You know,
it's
but
all back
again, there's no, you know,
Clear.
it's never too late. It's never too late. You know, that's what I tell everyone. I mean, you know, we always try to optimize and get things better.
Yeah. And sometimes guys are the worst about, I'm just a tough guy.
Yeah.
Working through it. Go get it, man.
Go
If
get
you're
checked out.
feeling,
Yeah.
if you're feeling down, if you're feeling in the dumps,
Yeah.
go get it.
And I
Give it
think
a
that's
try.
a big thing is because I don't want to say like I'm close to that age. I can kind of interact with both sides. You know,
Right,
I've been
right.
I'm good with talking. I'm going to talk to you like a bro.
Yeah.
Or if you're, you know, if you need to be talked to more on a professional level, I'm going to gauge it. I'm going to make you feel
Yeah.
comfortable. You know, for a guy that's 40 years old and go see a young gal and try to
Mhm.
talk to these problems, they're not as open. You know, so
Right.
if you can
Right.
come in and open up, I think it's just across the board, man. So much easier to kind of come in and just talk to somebody that's really
Yeah.
easy to communicate with.
And I'm sure you do that with the women as well. You
Same
probably
thing.
have a
I make
girl
them
in
feel
there-
comfortable. Make them feel comfortable. I mean, I had a woman nurse practitioner that was working with me for a little bit. She got busy, and nothing against her. She was doing great in her
Right.
other thing, and I ended up having to kind of like, you know, start gravitating some women back over to me. But usually they hear about me because of their men or somewhere in their network. So
Right.
they're always like, oh, okay, I don't mind seeing you anyway.
Yeah,
I
right.
I wanted to see you.
Right.
I've heard about you. You see my husband or my girlfriends all talk about
you offer that Valentine's package.
Yeah, that's
two panels and a steak.
Yeah, Joey's gonna be your marketing.
That's
director.
right.
I
man.
like
got
it, man.
you.
I like it.
Well,
Yeah.
Kendrick, dude, thank you for
Yeah,
stopping in.
appreciate
I knew
it.
this was going to be a
It was
good one. man. I
Pleasure,
hope-
man.
you.
Pleasure. I've been waiting for it for a long time, man. I
Yeah.
love and again, anything I can ever do, man, you let me know.
Hell yeah, dude. Just
absolutely.
probably come in again and just shoot the shit with us.
Yeah,
of
yeah,
course,
yeah,
of course,
it's
man.
good.
Brown
Easy.
water,
So-
get on the brown water.
Yeah,
and
get on
just,
the brown water
yeah,
train.
yeah, no
Yeah.
doubt, man.
Well,
I appreciate you.
I thank everybody for watching on the live, and I hope y'all learned something out there.
I
You
did.
know, it's definitely in the wheelhouse of
For sure.
of the man show here. You know,
And this
Brown
is a
water-
problem for everybody, men
Yeah.
and women.
There you
So
go.
figure it out.
You can't get around this, man. I tell you, there ain't no
Yeah.
light at the end of this tunnel.
Yeah.
You ain't
Right.
waiting this one out.
And time wins all. We
That's
should
right.
try to fight it off for
For
a little
sure,
bit.
for
But-
sure.
All right. Well, if y'all keep tuning in, we'll keep doing these. Be sure to download the Brownwater Banter app. It's on Apple, the App Store and Google Play. So
Yep.
stay connected to everything we're doing, and we appreciate it. We'll see y'all on the next one.